Now, there is something which is known as the axis of the QRS complex, which is also commented on while reading an ECG. So in order to understand the QRS axis, we have to revisit the heart and the way the electrical forces move. Now, in a normal QRS complex, we see the movement downwards and towards the left side. This is known as a normal QRS vector, which is normally said to be between positive 90 and negative 30 degrees. Say if we make a graph, the x-axis is 0, and moving downwards is positive 90 degrees and upwards is negative 90 degrees. The normal QRS vector will lie in this area, between positive 90 and negative 30 degrees. If there was a left axis deviation, the vector would lie between negative 30 and negative 90 degrees, which can be caused by a left bundle branch block or a ventricular tachycardia in which the heart rhythm originates from the ventricle. There are also conditions that cause a right axis deviation, such as right bundle branch block or right ventricular hypertrophy, in which the QRS vector lies between positive 90 and positive 180 degrees. So how do you determine the axis using an ECG? In order to do this, we look at specific leads throughout the ECG and see if the QRS is pointing mostly upwards, which is a positive deflection, or downwards. On the same graph, in lead 1, a positive deflection is towards 0 degrees and a negative deflection is towards 180 degrees. In lead AVF, a positive deflection is going downwards towards positive 90 degrees, and a negative is going upwards towards negative 90 degrees. So when you sum them together, you get a vector at the normal QRS axis. Now let me go over this again, just so that it makes better sense. Now if leads 1 and AVF are both positive, this will be a normal axis between 0 to positive 90 degrees. If lead 1 is positive and lead AVF is negative, this will be between 0 to negative 90 degrees and a left axis deviation. If lead 1 is negative and lead AVF is positive, this will lie between positive 90 to 180 degrees and a right axis deviation will be seen. And if both leads 1 and lead AVF are negative, this is an extreme axis and lies between negative 90 to 180 degrees. I'll now tell you a really quick method which doctors use to determine the axis. First, we glance at the AVR. It should be negative. If not, then it means that the leads are not placed correctly, or there is a limb lead reversal. Next, you look at leads 1 and 2. Now, if leads 1 and 2 are both positive, the axis is normal. If lead 1 is positive and lead 2 is negative, this is a left axis deviation. The only exception is if lead 2 has a slightly up and slightly downward deflection. This is a physiological left axis. And then if lead 1 is negative and lead 2 is positive, this is a right axis deviation. So here's a table to simplify this even further. Now in a normal axis, both lead 1 and lead 2 point upwards, have a positive deflection. In left axis, which is physiological, the lead 1 points upwards and lead 2 has both slightly upwards and downwards deflection. In left axis deviation, lead 1 points upwards and lead 2 has a negative deflection, while the opposite happens in right axis deviation, where lead 1 is a negative deflection and lead 2 is a positive deflection. So that was how you determine the axis using the ECG. Next, we're going to talk about intervals and how to interpret some of them.